What does the RICE method mean when treating an ankle sprain? A. Rest, ice, compress, elevate. B. Relax, ice, contort, elevate. C. Remove, inject, compress, embrace. D. None of the above. And the correct answer is A. Rest, ice, compress, elevate. As soon as possible after an ankle sprain, you can relieve pain and swelling and promote healing and flexibility with RICE. RICE stands for rest, ice, compression and elevation. Your friend is having a seizure and an ambulance is on the way. What can you do to help him? A. Make him safe and prevent injury. B. Help him take his medicine. C. Take a video to show him what happened later. D. Leave him alone and give him privacy. And the correct answer is A. Make him safe and prevent injury. The important action here is to make your friend safe and preventing injuries. CPR involves which of the following steps? A. Chest compressions and rescue breaths. B. Rescue breaths and abdominal thrusts. C. Chest compressions and abdominal thrusts. D. Abdominal thrusts and finger sweeps. And the correct answer is A. Chest compressions and rescue breaths. CPR or cardiopulmonary resuscitation is an emergency life-saving procedure which involves chest compressions and rescue breaths. CPR is a procedure performed when the heart stops beating. Immediate CPR can double or triple the chances of survival after cardiac arrest. During an asthma attack, which of the following statements is true? A person's airways narrow. B. A person's airways expand. C. A person's airways stay the same size. D. A person's airways starts bleeding. And the correct answer is A person's airways narrow. When someone is having an asthma attack, their airways narrow, making it difficult for them to breathe normally. What does AED stand for? A. Automotive engineering defibrillator. B. Automatic external detection. C. Automated external defibrillator. D. Anti-Epileptic defibrillator. And the correct answer is C. Automated external defibrillator. Automated external defibrillators are portable, life-saving devices designed to treat people experiencing sudden cardiac arrest, a medical condition in which the heart stops beating suddenly and unexpectedly. Should we restrain someone having a seizure? A. Yes, restrain them for 5 minutes, then let go. B. No, don't restrain them. C. Yes, restrain them until the seizure has passed. D. Both A and C. And the correct answer is B. No, don't restrain them. Don't restrain someone who is having a seizure. You should protect their head from injury using a blanket or something soft. When we apply pressure to a bleeding wound, we are acting like A. Plug, B. Hose, C. Drain, D. Both B and C. And the correct answer is A. Plug. By applying pressure to the wound, you are acting like a plug, helping the blood to clot and stop the bleeding. Which of the following everyday items would be most effective for putting pressure on a bleeding wound? A frying pan. B. A rolling pin. C. Cling film. D. A tea towel. And the correct answer is D. A tea towel. It is ideal to use something clean and absorbent, like a tea towel or a piece of clothing. Hari's friend has swallowed something harmful. Other than asking his friend, what else might help him find out more information? A. Calls he might have recently made. B. Websites he might have been browsing. C. Selfies his friend might have taken. D. Packaging near his friend or in the house. And the correct answer is D. Packaging near his friend or in the house. The key things you need to find out are what they have taken, when and how much. Packaging will help you to do this and give medical professionals the information they need. After a seizure has passed, what should be done? A. Leave the person on their back. B. Roll the person onto their side. C. Don't touch the person at all. D. Roll the person onto their front. And the correct answer is B. Roll the person onto their side. After a seizure has passed, roll the person onto their side with their head tilted back to help them to continue breathing. What do people with asthma use to help them breathe? A. Auto-injector. B. Inhaler. C. Ice pack. D. Dextrometer. And the correct answer is B. Inhaler. As an emergency home remedy for asthma attack, rescue inhalers allow a person having an asthma attack to inhale their medication. When inhaled, the medication relaxes the muscles in the airways. This causes the airways to widen, reducing breathing difficulties. If a person has hypothermia, how should we help warm them? A. Put the person in a hot bath. B. Give them a hot water bottle. C. Wrap them in a blanket or extra clothing. D. Place them next to an open fire. And the correct answer is C. Wrap them in a blanket or extra clothing. If a person has hypothermia, you should warm the person by wrapping them in a blanket or extra clothing. If someone is unresponsive, which three senses can we use to tell if they are breathing? A. Sight, smell, sound. B. Sight, sound, touch. C. Sound, smell, touch. D. Smell, touch, taste. And the correct answer is B. Sight, sound, touch. Sight, sound and touch can help us look, listen and feel for breaths in someone who is unresponsive. Which of these things could we use to support a broken bone? A. Someone's hand. B. Some clothing. C. A cushion. D. All of these. And the correct answer is drop your answers in the comment section below. If you like this video, don't forget to hit that like button. Thanks for watching.